Hi, I'm Carrie with In Motion OC Physical Therapy in Irvine, here to talk to you about a common injury, patellar tendonitis. This is an injury that you usually feel in the front of your knee, right here. And it usually occurs with people that do a lot of running or jumping. And what happens is your legs go in a little bit and it causes the patella to move outside this groove in your thigh bone. And so what happens is it causes it to get painful and inflamed. So what we want to do is give you some exercises to help with this injury. Take into consideration that if you are very painful right now, to not do anything, we recommend actually doing this thing called R.I.C.E. So you want to rest it, you want to ice it, you want to compress it with like an ice bandage, and you want to elevate it. Once the swelling and the pain goes down, then it's time to do these exercises that we're going to show you right now. So this exercise is called straight leg raises, and we're going to add some pauses to it. So what you're going to do is you're going to have one leg straight on the table, and you're going to raise it up, and then you're going to do 4 pauses as you go down. So you're going to go 1, 2, 3, 4. So for this one, what you want to make sure is that your back is actually against the table. You don't want it arching up, okay? So push it up, down against the table the whole time as you raise the leg up. And as you slowly lower it down, so you're going to go 1, 2, 3, 4. And these are called the straight leg raises. Okay, so this exercise is called the clams, okay? So it works on a muscle that's in the back of your, or on the side of your butt. So what you want to do is lay on your side, make sure your hips are pointing straight up. You're going to keep your feet together, and all you're going to do is move your knees up and down. So go ahead. So with this one, you want to make sure, like I said, hips are straight up. And you don't want to bend too much over, so you want your back nice and straight the whole time. And you should feel it right here on the side of your hip. And these are the clams. The next one we're going to do is called a hip flexor stretch. So this stretches the quads and then the hip flexors that are a little bit more up here. So a good way to do it is with a chair. So what you're going to do is put your foot up, make sure it's out a little bit in front. So you don't want your knee to go past your toes. Okay, so what you're doing is actually stretching the leg on the floor. Okay. So make sure that your toes and your heels are in line, okay? You're gonna just go forward until you feel a stretch in the front. If you don't feel a stretch, there's a good chance that you're arching your back. So try and make your back nice and straight, and then you're gonna hold this for 30 seconds to a minute each time. So once again, this is called the hip flexor stretch. So this exercise we're gonna do is it's called the calf stretch. So the calf is made up of 2 muscles, the gastroc and the soleus. So the first one for the gastroc, you can use a step or a stair, anything that you might have at home. But you want to be able to have your heel come off the end, okay? So the key for this exercise is you want your knees straight and you want your toes in front of your heels. So when you do this, you should feel it more in the gastroc, and that's this area right up here, okay? So when you're doing this, hold it for 30 seconds to a minute. Make sure you get a good nice stretch. After that, to work more of the soleus, you want to bend your knee. Same thing, toes in front of your heels. This one you should feel a little bit lower. So it should be back here, okay? So the key for these stretches is you want to be able to hold it for 30 seconds to a minute, and you want to be able to feel it where you're supposed to without any pain. So once again, these are called the calf stretch. So this exercise is called foam rolling. So we're going to foam roll 2 body parts, your IT bands, which are along the side of your leg, and your quads, which are along the front. So how you do it is you're going to lay, first we'll do IT bands. So you're going to lay on your side, on the foam roll, and you're going to go back and forth against it. You can use your leg just like this if it's too much, or if you can't handle the pressure as much. And then if you're really good, you can lift up both legs up and roll again. So you want to go all the way from your hip all the way down to your knee for this one. And then for the quads, you're going to go on your stomach. So same thing, rolling along the foam roll, and you're going to go all the way from your hips all the way down to your knees. And so for this, you want to make sure you foam roll for about a minute on each side. And once again, it's called foam rolling. So for the exercises we just did, just know that it's a generalized program. It doesn't take into consideration your individual differences. So if they're painful at all, we recommend that you stop what you're doing and go seek further evaluation. But for these exercises and this injury in general, we recommend that you stretch, 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 because that's very important for this one. And then once again, just stop if anything becomes painful. If you are interested in getting physical therapy, it is covered by insurances, and we're more than willing to help you out. Our website is inmotionoc.com, and we'll see you soon.